Hello and welcome to Round Robin. I'm your host, Robin McCormick with the City of Hampton. And today we have some tips to keep you healthy this winter, and if you do get sick, what to do about it and how not to spread it to the rest of us. My guests are from the health department. Welcome to Megan DeWitt and Beth Carroll. Hello, ladies.
Hi, good morning.
Thank you for coming back.
Thanks for having us.
We need to remind people about this every year. Why is that?
Every year. It's so important. It's the best way to protect yourself and others against the flu.
And the flu, people get it mixed up. They think every time they get sick, whether it's a stomach virus or a head cold, how do you know what is the flu?
Well, people will tell you if you have the flu, you're going to know that you have it. The symptoms of flu and cold can sometimes be very similar, but with the flu you find you'll have a fever, although not everyone has a fever, but that is one of the symptoms. You'll have chest discomfort. The biggest one that we hear are like muscle body aches, which you don't typically get with a cold.
Right.
You'll get a headache with the flu, where that's a little less common with the cold. But there are similar things, runny nose, cough, things like that, where you'll see that more in a cold and a little less in the flu. But if you have it, you're going to know that you have it.
You do sort of feel like you've been hit by a truck.
Yes.
You just hurt all over and kind of can't get up, right?
And flu tends to come on very quickly. You can feel fine at lunchtime, and by evening, you're very sick, where colds tend to come on more gradually.
Okay, so we don't have to get the flu. There's a way to prevent it most of the time. It's not 100% perfect. The strains change. We're guessing a little bit. Mm-hmm. Why don't people get a vaccine?
Well,
let's ask Beth.
A lot of the reasons that we get, a lot of people don't realize that they need it. They think it's only for older people or babies or people with heart disease, and it certainly is for those people.
I'm healthy and young, I don't need it.
Right. And what they don't realize is young people get flu, and young people get very sick from flu.
And it's true, they're not as likely to have severe complications or to die from it, but it's a pretty miserable experience for like a week or more, right?
Yes.
I think last year, a lot of the cases, and the very serious cases and hospitalizations were young people, 20s and 30-year-olds. And the other thing is school children and young people are very much carriers of the flu and spreaders of the flu. So in that school environment where lots of kids together, not very good about covering their noses and mouths, they are the ones that spread the flu.
So even if you don't think you need it or you think you can weather the flu if you do get it, remember that if you're around particularly young children, older people, people with asthma like me or other conditions, it can be so much more serious. So they're sort of first in line for who should get it. But you're saying everybody should get it.
Everybody. Everyone 6 months of age and older should get the flu vaccine.
And that protects the rest of us. I think a lot of people with vaccines sit back and say, well, if everybody else gets it, I don't have to have a shot.
Yes, definitely.
But they should. Now, does it cost? And that's the thing, it's easier now than it used to be. Like drugstores, your doctor, the health department, there are a lot of places you can go and get it.
Yes.
Right. There have been several big flu clinics. Some of our local health systems have had flu clinics. So, watch
Hampton.gov.
Hampton.gov and in the newspaper, and those things are advertised. The health department clinic is open every day, walk-in clinic. There is free flu vaccine available for adults that don't have insurance or their insurance doesn't cover it, as well as the insurance that you get like at your doctor that's billed to your insurance.
Right, and Medicare covers it. A lot of insurances cover it, either 100% or with a really small copay. And if you think, gee, I don't have time to miss work to go get a shot, you're going to miss a lot more work if you get the flu.
Definitely.
You really are.
Absolutely.
Okay, so if I have ignored the vaccine and I do get the flu, what do I do?
Stay home.
Stay home.
Stay
That's
home.
Really
Do
important.
not bring it into work or school. Rest. Drink a lot of fluids. And you just have to kind of wait it out. There are some medicines available through your doctor, but you'd have to talk to your doctor about those, some antivirals. But the main thing is just letting yourself get well. staying home and resting.
Now, let's just talk for a second. Flu is a virus. There are infections caused by bacteria. I think a lot of times people get sick, walk into the doctor or the clinic, and expect drugs. They expect antibiotics or they expect a drug that is going to fix it.
Right.
Does that happen with the flu?
That's not true. And we don't want to use antibiotics, obviously, for viruses. Overuse of antibiotics causes us problems too. There are some antivirals for certain people in certain
That may work.
situations that may work and may lessen the course. But
And there are
general,
things that could improve some symptoms if you have a particular problem with cough or something else.
or flu goes into some of those bacterial infections if it leads into a pneumonia or something more serious.
And I want to add, I think it's important to note that there are just general everyday things we can do to protect ourselves. So obviously we want everybody to get the flu vaccine.
Right.
But you can do other things that are just as important, like washing your hands
Well,
and washing them
help with
often.
other things too.
Yes.
You've got colds, you've got sinus infection. I mean, there's all kinds of stuff running around in the winter. Okay,
Definitely.
so I interrupted you though.
No, you're fine.
So wash your hands.
Wash your hands.
All the time.
All the time. And if you don't have access to soap and water, use hand sanitizer. You know, it works as well. You can do things, cover your mouth, cover your nose when you cough and sneeze. Sneeze into your sleeve. If you use a tissue, as soon as you're done, throw it away, and then go wash your hands. So there's lots of things you can do. And then you can kind of step up your household cleaning too. The flu virus is pretty fragile, so it can be killed easily with household disinfectants. So just be a little more vigilant, clean like doorknobs, things that you wouldn't think
You
to
know,
clean.
I only do it once somebody in the household is sick, and then I get through with the frenzy.
Right.
But I could do it a little sooner, a little more often. Doorknobs and light switches.
Yes,
And phones, your
your phone.
telephone, things that you have your face up.
your steering wheel of your car. You know, just things you don't normally think about to clean. Just kind of step it up a little bit.
Okay. What else? What are some other infections that people get this time of year, and how might they know the difference? I know I'm particularly susceptible to sinus, which almost
I am
always
too.
then becomes bronchitis.
Okay.
Is there anything you can do about that? I mean, trying to keep them clear, hydration, saline.
Kind of the same thing, following the same good hygiene practices. You know, avoid contact with people who are sick. So, and then, as we've said before, stay home if you're sick so that you don't spread it to anyone else.
Now, what do you do with kids? Because if there's an infection in the classroom, it's rampant. It's very hard to control. How do you teach kids? Isn't there a way to teach kids about coughing into their elbow? What do you
Yes.
say? Show me how you do it.
Yeah, so you're coughing in, or at least just covering, but they can cough into their elbow. And kids are very good. I was just telling Megan, my grandson has learned it very well. He's 4, and I was seeing a video. Every time he coughed, covered his
Oh,
mouth.
that's good.
So they can learn. And
We used to tell them to be like the Count on Sesame Street, you know?
Oh, that's
you
right.
pull
That's
that,
good. Say
pull
it.
that cape around
something
you.
that makes it a little more fun. Yeah.
Definitely. And then, of course, it goes back to washing your hand and cleaning the surfaces, because if they're
that's
coughing into their
hard with
hands,
kids, right.
then they touch that surface and somebody else comes along
Kind
and
of why
touches
the elbow,
their mouth
the
and
elbow
nose.
works really well
Yes.
with kids, because then it's kind
And
of
that's what we teach when
They're
we go
not
out
very
and
good
talk.
about remembering after you've covered your, not to touch things.
Right.
So if they've used their sleeve, then they're not worrying about spreading as much. But in schools and daycares, it's just really important to do a lot of cleaning surfaces, cleaning toys, cleaning the play table, because
Yeah, even in your own house, if you have a play date, if you have other kids over, you want to keep all that stuff
Yes,
clean as much as possible.
especially this time of year.
Okay, is there anything else? Do we know yet if it's going to be a bad flu season? It hasn't hit when we're taping. Who knows what'll happen by the time we air?
Flu activity is really low overall right now, but it's important to keep in mind that here in the United States, flu activity tends to peak between January and February, so it's not too late to get your flu vaccine.
But don't wait until somebody you know is sick, because
Right.
there's a little time before it kicks in, right?
Yes.
Beth, how long is that?
right, it's about 2 weeks for a vaccine to work. And the other important thing to remember is for children under 8 need to get 2 doses of flu in the same season. So for them, if you wait until everyone's sick around you in your community, it's going to be about a month and a half before that child has full protection, if they haven't had flu vaccine in past years. So it's really important when we have families come in with young children in the midst of flu season. and they don't understand that their child's really not going to be protected for over a month.
Oh, that is a long lead time.
That's a long time.
Okay. All right, so I'm going to recap real quickly. We are going to get our vaccine. I've already had mine, but I'll remind some folks out there, if we do get sick, we're going to stay home and not spread it to other people. We're going to cough into our elbows. We're going to clean a lot more.
Yes.
I mean, it's really, you can make it easy by just taking wipes to things and
Yes.
blowing through the house real quickly on those key surfaces.
Definitely.
The other thing I just remembered with the children, one of the things I saw is the kids wore a little like cowboy bandana around their face, something that covers
that's
them.
fun. Yeah.
They don't think of it as being so.
It's not a surgical mask. It's a little less scary, more like playing.
It is more like playing, absolutely.
Okay, well, thank you both very much.
Thank you.
I enjoyed being here. Thank you.
And thank you for watching. I hope you will get a vaccine if you haven't already. And let's try to make this a happy, healthy winter. Thanks for watching.